Okay, so I did my project and paper on astrocytomas and the affected patients, kind of the long-term effects, and it was based off a real-life patient, which I will get into. And basically, I'm going to explain how astrocytomas affect people and the long-term effects that are caused from the treatment and the chemo from it. So, what is an astrocyte? It is a star-shaped brain cell that is most susceptible to turning into a brain tumor. And the specific one I'm getting into is called a high-grade glioma. And it has 4 grades, so grade 1 and 2 are very slow growing, and they're the most benign, so less harmful. And then grade 3 and 4 is rapid growth, and they're the most malignant. And on the right there's like a picture of the brain tumor as it's developing. So the symptoms of astrocytoma are a headache, vomiting, lethargy, visual issues, papilledema, microcephaly, and behavioral issues due to the cognitive areas being affected. So there's 3 stages in treatment. There's surgery, radiation, and chemo, and I will get into the surgery portion in a second. And basically, for treatment, nothing is really guaranteed because the gliomas are almost always going to regrow. So there's very, very low chance that you will have only one stage of treatment. And since there's a high resistance, they need to do different kind of treatments if they regrow because of how they can usually come back stronger. So the neurosurgical total resection is the most common form of the surgery to remove the brain tumor. So there's 2 different kinds. There's the complete or total resection, or there's the partial, which is just a biopsy. And these can lead to tons of different cognitive development issues in children, since it usually happens when they're pretty young. So it develops how they develop as a person, and it affects the developing stages in the brain. And it causes a lot of social, emotional, and behavioral functioning issues with everyone. And I found in a small study that there was 20% of children with brain injuries that develop ADHD. So there's the social, emotional, functioning issues, which emotional instability is a big one, and they have a lack of social problem solving skills, so they don't know how to act in environments that they're put in usually, and they don't know how to kind of act around other people. And then there's behavioral issues, so there's tons of aggression and anger, anxiety, lack of self-control, and inappropriate behavior because they don't know the difference between right and wrong. So these are the commonly known side effects of the neurosurgical total resection surgeries. So after the NTR takes place, a lot of researchers have found that 5 out of 7 children had intellectual deterioration and learning disabilities and psychopathology, and they had increased risk of memory dysfunction and academic failure due to the obvious lack of memory dysfunction. So they struggle in school more and typically are put into special education environments because they can't keep up with the normal pace that students are typically put in. So there's also increased sensibility and lower frustration tolerance. So that's why they start to act more, because they become more sensitive and they kind of have a lack of that tolerance, so they become more frustrated. And then 5 out of 7 patients have psychiatric problems, which deals more with just what part of the brain was affected. So these are other possible reported long-term effects. So there's radionecrosis, myelopathy, endocrine deficiencies, bone and tooth abnormalities, ototoxicity, baldness from chemo, neurocognitive problems, just a ton of different problems, and even sometimes it leads to more tumors and more cancers. So this is the patient I studied. Her name is Mary Jane. She survived having astrocytoma. She had a grade 3 glioma, so it was a pretty high grade. And she was, I think, only a couple years old at the time when she got it. She's about 8 or 9 now. So she had her first surgery, and she had 25% of her left hemisphere of her brain removed. So the entire left temporal lobe was removed from her brain, and parts of her parietal and occipital lobes were removed, and she lost her vision in both eyes, basically. She wears glasses now to help take care of it. And then there's hemiparesis on the left side, so she was paralyzed when she woke up from one of her surgeries, and she's still kind of weak on that side, but she can walk again. And then she also developed hydrocephalus, which is water on brain, and it's when her brain was incapable of absorbing the cerebrospinal fluid from the chemotherapy. The medicines affected how that absorbed, so she got a shunt which helps naturally drain it, and there's many different kinds of shunts, and the shunts help drain the fluid, and a lot of people go through hundreds in their lifetime. She also developed a staph infection, and she also had, in chemotherapy, she had about rounds that lasted a couple months. I think she had a few, so maybe 3. So the chemo drugs really affected her. The major part was it affected her blood count, which made her have blood transfusions pretty much almost every day. And in her final round of chemo, they gave her different drugs, and the medicine destroyed her bone marrow, and she had stem cells. She had a stem cell rescue because her stem cells were so low and they needed to be restored for the bone marrow to form again, I guess. And she needed them daily at one point, so she basically had no immune system at this point. She had a lot of cognitive damage, which she still deals with. She had to relearn how to walk and eat and drink, just basic everyday life things she had to learn because of the damage. And the stem cell treatment increased her risk of cancer and tumors, so she's very susceptible to getting the same tumors and other different cancers, and she has seizures daily. So she sees a ton of specialists for this. She sees a neuro-oncologist, a neurosurgeon, and a behavioral specialist. And she has yearly MRI scans of her brain and spinal cord at the hospital, and she also gets yearly blood tests done when she's there. Her medications include medications for seizures, for her hypothyroidism. She has an antipsychotic to keep her calm, which doesn't always work because of her other medicines. They kind of make her, the medicines kind of don't have the same strength they would normally, so they just basically don't work. She has a sleeping medication because she can't sleep very well, especially because of her PTSD. And then she has a nutritional drink because she doesn't get enough food because she developed a feeding disorder, which I will get to. But she lacks the nutrition she needs because of that, so she gets a nutritional drink that she takes. So the other effects that happened to her were basically cognitive damage, caused behavioral issues, so she has a ton of aggression. She got PTSD. The medicine doesn't work, like I said before. The medicine she takes now developed an abnormality in her EKG, so she has to they have to check her EKG every time she gets a medicine dosage change or she changes medication, just to make sure that her heart can handle it. Like I said before, with the sleeping medication, her sleep center in the brain was damaged, and she developed a feeding disorder, and she has dysautonomia, and it's basically where she can't be out in the heat for too long because she'll get very red, and then it also triggers her seizures to start happening, so it's very dangerous for her to be outside for too long in the heat. So everyday life, how she kind of deals with this and the long-term effects, she does her therapeutic horseback riding for her behavioral issues, and at home she sees a behavioral specialist to work with her, and in school she receives OT, PT, speech, and adaptive PE, and she's also enrolled in special education due to the fact that she is missing a ton of her brain, and she can't keep up with children like her age. She can't keep up with. She's in middle school now. She's been in special ed ever since she was young, and she will have to continue to be in special education until she's 22 due to the brain damage that she has. So essentially, the whole thing is on astrocytomas, and specifically a high-grade glioma. And I used the long-term effects recorded from other patients and known to be the most common forms of the long-term effects, and then I used a real-life patient and studied the effects that happen due to her treatment, and it kind of shows how the affected patients deal with it and the different things that stem in from having brain tumors, and the different side effects that happen, and a majority of it is long-term effects, and some people can't recover from the cognitive damage. So that's all about astrocytomas.